March 15th, 2026, 3:12 a.m., Mercy General Hospital, Boise, Idaho. The ICU's sterile hush shattered as a shrill alarm sliced through the dark, a red light pulsing on Sophie Morgan's monitor. Her mother, Dr. Laura Morgan, lurched from her chair, her hand clutching Sophie's, as nurses swarmed the room. Sophie, 13, lay still, her fragile frame lost in a tangle of tubes, her chest rising only with the ventilator's mechanical rhythm. A pimple on her tongue, a trivial irritation days ago, had spiraled into septic shock, turning her blood into a battlefield. 3 days earlier, she'd been doodling constellations in her notebook, laughing with her best friend. Now her heart had stopped. Laura's world hung on a single desperate question. How could something so small hide such a deadly secret? Stay with us as we unravel a story that will seize your heart and make you wonder, what small sign are you missing in someone you love? Sophie Morgan woke to the buzz of her phone alarm in their Boise apartment. The March morning crisp and gray through her frost-laced window. At 13, she was lanky, reserved, with gray-blue eyes that saw more than she said. Her room was a clutter of star charts, watercolor paints, and a scuffed soccer ball from her dad, Michael, who vanished when Sophie was 6. She pulled on a faded sweatshirt, avoiding the mirror where she'd noticed a sore, red bump on her tongue. A pimple, she thought, grimacing as she sipped orange juice. At school, her friend Ellie teased, "Whoa, your tongue's got a crater." Sophie forced a smile, but the jab stung. Life felt heavy. Her mom, Laura, a trauma surgeon, was always at Mercy General, and her dad's absence was a quiet ache that never faded. Laura left a note on the counter. Muffins in fridge. Love, Mom. Sophie grabbed an apple and headed for the bus, the dull throb in her tongue barely registering. School dragged through science quizzes and cafeteria chatter, but the teasing about her tongue lump cut deeper than usual. By noon, the bum pulsed hot and swollen, making it hard to eat. Sophie hid it, sipping juice, brushing off the growing haze in her mind. She'd learned to swallow discomfort. Laura's endless shifts left little room for Sophie's quiet struggles. That evening, Laura, still in scrubs, barely glanced up from her laptop when Sophie mumbled about her tongue. "Just a sore, honey," she said, distracted by case notes. "Rinse with warm water." Sophie nodded, not mentioning the fever creeping in or the strange weight in her limbs. Kids don't always know how to voice their fears, do they? She curled up in bed, the pain sharpening, a whisper of something she couldn't name. By Thursday morning, Sophie swayed as she dressed, her sweatshirt too warm against clammy skin. The pimple was scabbed, the tissue around it red and puffy, with a faint red streak trailing toward her throat. Laura had left for a 5 a.m. surgery, leaving a note, "Study for your test." Sophie trudged to school, her head throbbing, her legs unsteady. She slumped through classes, her sketchbook untouched, her lunch ignored. Her teacher, Mr. Hayes, noticed her pallor. "You okay, Sophie?" he asked. "Just tired," she murmured, her tongue too sore to speak clearly. On the bus home, she shivered, pressing her face to the cold window, the world blurring. At home, she collapsed on the couch, pulling a quilt tight, the Idaho chill no match for the ice in her bones. Laura found her at 6:30 p.m., her heart jolting at Sophie's fevered face. "Sophie, wake up," she said, her surgeon's instincts flaring. Sophie's temperature was 103.9 degrees Fahrenheit, her pulse racing at 135. Laura examined her tongue. God, it was a hard, inflamed knot, the red streak now stark against pale skin. As a trauma surgeon, Laura knew the signs. Cellulitis, possibly sepsis. She'd seen patients crash from less. "Just a pimple," she whispered, trying to calm herself. She gave Sophie ibuprofen, cool cloths, and broth, but her eyes were glassy, her breathing shallow. Laura set up an old baby monitor and sat by her bed, listening to her ragged breaths. At 3:12 a.m., a faint moan crackled through. "Mom, it hurts all over." Laura rushed to her, finding her curled up, drenched in sweat. This wasn't a sore. This was a war. Have you ever ignored a small ache, thinking it was nothing? What's hiding in plain sight in your life? Laura rushed Sophie to urgent care, The waiting room a blur of coughing kids and dim lights. Sophie slumped against her, too weak to sit up, her skin mottled. The physician assistant, young and rushed, frowned at Sophie's tongue. Bad infection, probably cellulitis, he said. Antibiotics will fix it. Laura pushed, her voice sharp. The fever, the streak, it's moving fast. He nodded, prescribing amoxicillin. ER if it worsens. Laura's gut churned. She'd seen sepsis in the OR, patients who tanked in hours. But this was Sophie, her daughter, not a patient. She drove home. Sophie's head lolling against a window, her breaths uneven. By midnight, Sophie's fever hit 104.5 degrees Fahrenheit, her pulse a frantic 148. Laura called Mercy General's nurse line. They said, "Are now." At the hospital, the triage nurse rushed Sophie to a bay. Dr. Rachel Torres, pediatric emergency chief, took over, her sharp eyes scanning Sophie's vitals. "Sepsis," she said, her voice firm. "The tongue infection's gone systemic, triggering a cytokine storm. Her immune system's attacking itself." Laura's knees buckled. "It was just a pimple," she whispered. Torres was blunt. "The mouth's blood vessels feed the brain. Staph or strep can turn a tiny breach into chaos. What small signal have you dismissed? Thinking it's no big deal. Who might be fading right in front of you?" Sophie was whisked to the pediatric ICU, a sterile labyrinth of beeping monitors and white walls. Her blood pressure crashed to 83/46, heart rate spiking to 142. For fluids, vancomycin and vasopressors flooded her system, battling the infection that had seized her body. The red streak on her throat faded slightly. But her face was swollen, her tongue a grotesque mass pressing against her airway. Laura stood outside the glass partition, watching nurses adjust the ventilator, keeping Sophie alive. Dr. Samuel Chun, a critical care specialist, reviewed her chart. High lactate, rise in creatinine, dropping platelets, early multi-organ dysfunction. The staff's releasing toxins, he explained. Her body's fighting itself, causing damage. Laura, usually unflinching in the OR, felt her world splinter. "A pimple," she repeated, her voice breaking. At 3 a.m., an alarm blared. Cardiac arrest. Laura slid to the floor as the team swarmed. Dr. Torres called for epinephrine compressions, defibrillator shocks. 5 excruciating minutes later, a nurse shouted, "Sinus rhythm!" Sophie's heart was back, fragile but beating. Torres knelt beside Laura. "We're moving to ECMO, heart and lung support. It's her best chance." Laura nodded, numb, as specialists inserted cannulas. Sophie's blood cycling through the machine, dark to bright red. It was raw, mechanical, but it was life. Laura sat by her bed, clutching Sophie's notebook, its pages filled with constellation sketches and scrawled thoughts. "I wonder where Dad went. I feel like a star no one sees." Laura's guilt was a knife. Had she been too consumed by work to notice Sophie fading? The next morning, an MRI revealed the impossible. A metallic object embedded in the infected tissue of Sophie's tongue. Dr. Torres studied the scan, brow furrowed. Foreign body, maybe metal fragments. Any trauma history? Laura's breath hitched. She's 13. No surgeries, no injuries there. But a memory surfaced. Sophie at 6, sobbing after a weekend with her dad, Michael, holding her mouth, saying it hurt. Laura had brushed it off, distracted by her crumbling marriage. Michael had been volatile, his drinking escalating, his anger unpredictable. She pushed the thought down, but it clung like damp air. Dr. Chin ordered urgent surgery to remove the object and infected tissue, warning, "It's worsening the sepsis." "We can't wait." Laura prepared Sophie for surgery, her hands shaking as she smoothed her daughter's hair. "You're so brave, my star," she whispered, her voice cracking. Sophie scribbled on a notepad, "Why does it hurt so bad?" Laura had no answer, only fear. As Sophie was wheeled away, Laura sank into a chair, her mind spiraling to 2019, when Michael vanished. He'd been a welder, charming until the bourbon took over. Their marriage was a storm, shouts, shattered glass, bruises Laura hid under turtlenecks. One night, after he grabbed her throat, she fought back, swinging a hand mirror in panic. It cracked against his head. He collapsed, blood pooling. Terrified, she buried him in a remote field, staging his truck at a rest stop to suggest he'd left town. A gold locket, his mother's heirloom, had been ripped from her neck that night, lost in the struggle, or so she believed. Now, staring at Sophie's empty bed, Laura's pulse raced. Could the locket be in Sophie's tongue? Had she been there that night, a silent witness, picking up the pieces? Laura had never told Sophie about Michael, letting her believe he'd abandoned them. The secret had kept Laura safe but distant, her long hours at work a shield against questions. Her phone buzzed. Dr. Torres, asking her to meet in the OR waiting area. "We need to discuss Sophie's surgeon," she said. Laura's stomach dropped. "What secret have you kept?" "Thinking it was buried forever. What might it cost when it rises to the surface?" Sophie's surgery was led by Dr. Hannah Reed, 39, a maxillofacial specialist with calm hands and a gaze that pierced Laura's defenses. Hannah's name sparked a vague recognition, but Laura couldn't place it. The procedure stretched into its 6th hour, the team navigating the delicate, infected tissue of Sophie's tongue. The abscess was complex, but the real shock came when Hannah extracted a tarnished gold locket and fragments of mirror glass, embedded deep in scar tissue. The OR went quiet. The metallic glint surreal under the lights. "This has been here for years," Hannah said, placing the objects in a tray. "Old trauma, significant force." The resident, Dr. Kim, stared. "How does a kid get this in her tongue?" Sophie's vitals spiked under anesthesia, her heart rate surging as she mumbled, "Don't tell Mom. Dad's gone, the mirror broke." Hannah froze. The locket was her grandmother's, passed to her father, Michael Reed, before he vanished in 2019. She'd been 32, building her surgical career, when her dad disappeared, leaving her with fractured memories of his temper. Sophie's words hit like a shockwave, stirring a truth Hannah had long avoided. She finished the surgery, her focus unwavering, but the locket burned in her mind. She documented the objects as evidence of historical trauma, her hand steady but her heart racing. In recovery, Sophie woke to Laura's quiet presence, her small hand limp in her mother's. Hannah entered, her composure masking a storm. "Dr. Morgan, we need to talk about my father, Michael Reed." Laura's heart monitor beeped faster, her face draining of color. "You're Hannah," she whispered, recognizing Michael's daughter from his first marriage. "Met once at a tense family dinner years ago." Laura's voice broke as she confessed. "The abuse, the fatal night, the cover-up. He attacked me," she said. "I swung the mirror to stop him. He fell, hit his head. I panicked, buried him, staged his truck. I thought the locket was gone." Hannah listened, her surgical mind tracing the trauma pattern. Forceful impact, deep embedding. "Self-defense," she said softly. "Courts would see it that way now. You've carried this too long." Hannah shared her own piece. She'd been 4 when her parents divorced, her memories of Michael clouded by his drinking. "You were kind to me once," she said, recalling Laura giving her a daisy at that long-ago dinner. "It stuck with me." Hannah chose not to report the findings, her father's case long closed. "You taught me kindness matters," she said. "This is about healing, not blame." Sophie stirred, her eyes opening slowly. Laura squeezed her hand, tears falling. "I'm here, my star." Sophie scribbled, "I saw Dad that night. I took the locket. I didn't understand." Laura's heart shattered. She hadn't known Sophie had seen the fight, swallowing the locket in her fear. "What truth have you held, fearing it would break everything? How do you choose between justice and healing?" For months later, Sophie stood before her mirror, her tongue scar a faint line, a quiet mark of survival. She slept soundly, laughed freely, her notebook filled with new consolations and sketches of her mom's smile. Laura cut back her hours at Mercy General, trading surgeries for evenings with Sophie, their bond rebuilt through quiet talks and shared silences. Hannah visited often, their conversations weaving past pain into new purpose. Together, they launched the Morgan Reed Fund for Trauma Survivors. Sophie speaking at a Boise community event, her voice soft but steady. "A pimple nearly took me," she said, "but love pulled me back." Her classmates clapped, Ellie hugging her tight. Mercy General named a recovery wing after Sophie, honoring her strength. At home, Sophie gave Laura a watercolor. Her at Sophie's bedside, stars above them. I saw you, Mom, she wrote. Laura hugged her, whispering, I saw you too. On their porch, Sophie shared a dream of a starry path, choosing to return. I heard you, she wrote. Laura's heart swelled. Sophie's journal entry read, a pimple was a test. I passed. Small things matter. Laura read it, tears blurring her eyes. Nothing was small anymore. What small moment have you overlooked that could change everything? Who needs your eyes on them right now? Share your story below. What small sign reshaped your life? Subscribe, and let's keep shining light on the truths that matter most.